Hello, everybody. My name is Logan DeSanto. I'm a fourth year honors nursing student at the Penn State Ross and Carolyn East College of Nursing at the Scranton campus. My fellow co-authors include Dr. Michael Evans, Assistant Dean for Undergraduate Nursing Education at the Commonwealth campuses, Dr. Kieran Riley, a former graduate of the BSN to PhD program here, Clay Kowalczyk, a current student in the BSN to PhD student program, and my fellow undergraduate students included Lucy Adams, who is a senior honors nursing student at the Scranton campus, Megan Lucy, who is also at the Scranton campus and a third-year student, and Charles Robinson, who is a RN to BSN student at the Shenango campus. My project was titled Introducing Palliative Care into the Treatment of a Person with Recurrent Cancer. So for a little bit of background, palliative care is a specialized approach to disease management that focuses on a patient's quality of life and symptom management. Palliative care allows patients with cancer to receive care that is specialized to each patient and their family's needs at any point during the disease trajectory, especially considering patients with cancer can have such significant treatments that can have some debilitating symptoms. It is a team-based approach to care that gives a holistic care that targets all types of needs for the patient and family. So palliative care, of course, includes care decisions, addressing overwhelming symptoms, recognizing psychosocial distress, and emphasizing the patient. Our methods included a comprehensive literature search to identify barriers and best practices for introducing palliative care into patients with cancer. We utilized scholarly databases that included CINAHL and PubMed, and our keywords were palliative care, best practices in introduction, and barriers in introduction. So for our findings, for best practices, symptom management starts with a holistic assessment to determine what specific issues are important to be addressed. There are many different symptoms that patients can be feeling, so it's really important to figure out what means the most to them. Specific issues that may be targeted include anorexia, constipation, diarrhea, shortness of breath, fatigue, nausea and vomiting, pain, and as well as anxiety, depression, and spiritual needs. There are many different interventions that can be utilized through palliative care, and these include medications, medical marijuana, which has found some uses in pain as well as anorexia, art therapy, which is a great distraction technique to get their minds off of some pain and even the anxiety and depression, exercise, and physical, occupational, and mental health therapy. It is important to note that these findings can be considered for not only patients, but for caregivers as well, since they can also be experiencing some of these debilitating symptoms. And one really important thing that I wanted to highlight it in my banner was that early discussion regarding the implementation and availability of palliative care should be introduced early on in the disease process. This allows patients to have a clear meaning of what palliative care is and what services can be provided to patients and the caregivers as well. So our barriers included a lack of provider implementation. This could be due to a number of reasons, including the lack of specialists or even financial reasons as well. Poor integration into the healthcare system. This can be from lack of education or, again, some of those financial concerns as well. Lack of education training for patients, caregivers, and even providers or other members of the interdisciplinary team, including nurses, physical and occupational therapists as well. And racial and cultural differences. Many of these differences can lead to some patients not really wanting to utilize the services of palliative care due to their own practices, but their practices can definitely be incorporated into the services palliative care can provide. So some implications for practice include that healthcare providers should be further educated regarding the services that palliative care can provide for patients with recurrent cancer. Comprehensive assessments should be done for patients to have a specialized plan of care to target specific debilitating symptoms. And proper communication should be maintained between all members of the interdisciplinary team, patients, and their families regarding the implementation of palliative care. Thank you for listening to my presentation, and I look forward to any and all feedback.